Okay.
Okay.
Good morning, Dr. Wright. How are
Good
you?
morning. I am doing well.
Thank you so much for agreeing to participate in this HBCU CARES interview series. I am Christina Brantley, and I am currently a student at Clark Atlanta University. And I'm studying to be a school counselor. And this year, or today, I'll start my third year of the program. And I'll be interning at a middle school this semester and then moving to a high school next semester.
Very good.
So, the purpose of this interview is to let future behavioral health professionals know what their experience may be like. And also, it helps as a recruitment piece so that we can get more Black and Brown students interested in becoming a behavioral health specialist. As you know, we need more people in the field. So, in advance, thank you for sharing your experience. And we hope that it inspires a young Black or Brown boy or girl to pursue behavioral health so that they can be out doing the work that we're choosing to do. And as we say with HBCU CARES, we're just learning and creating a community of care. Um, so I'll let you introduce yourself, and some of the questions that I may ask you may overlap about just like your general introduction. But if you can introduce yourself before we go into the questions, that would be great.
Okay. So I'm Dr. Haley Wright. I am a school psychologist in Katy ISD, which is in Texas, Houston, Texas, a suburb of Houston, Texas. And I have been a school psychologist since 2009. And I went to my undergrad, HBCU, was Grambling State University. But I got um, my school psychologist specialist degree from Indiana University, Bloomington. And then I got my doctoral degree in counseling, education, and supervision from Hampton University.
Okay, we got a two-time HBCU. I love that for
Okay.
us. I love that. Okay, so
Loved it so much, had to do it again.
yeah. Yes. I'll ask you another question after. Yes.
Okay.
Okay. So when we hop into the interview questions, first, can you tell us about what you do in the behavioral health field as a school psychologist?
So as a school psychologist, what I am able to do is I consult with teachers, I consult with students, and I consult with parents about behaviors that are happening within the classroom and sometimes even behaviors that are happening in the home. I also do psychological evaluations, which look at autism, looks at ADHD, which what we call it here in Texas is OHI, other health impairment. In
Mm.
Texas, we have to have both a medical diagnosis as well as data to say that it affects the student's success in the classroom. And then we also look at what we call emotional disturbance, but that just covers all of the things. So, like anxiety, it covers depression, it covers just a myriad of extensive behaviors that may be happening at school and at home. We also do counseling. So I provide counseling to students that are here, but it's not extensive counseling. We always want to make sure that parents know and understand that it's not counseling that you would receive outside of school. It's not that type of intensity because we don't have that type of time, but we do always want to suggest that students get extra help outside of school if that's something that's needed. And then we also do what we call psychological consultation, which just kind of checks in with students to see where they are. They may not need that consistent, they may not need that consistent plan like a counseling IEP would provide, but they just need somebody to check in with them periodically to see how they're doing. Um, Behavioral wise, but as well as academically. So we just want to make sure that students have the best success they can or be put in the best environment so that they can have the best success possible.
That's incredible. Your plate is full.
Mhm. We do a lot. It's interesting because my job position here in Katy, Texas looks a lot different from my practicums that I did when I was studying to be a school psychologist because different states do different things.
Okay.
And so here in Texas, just maybe a month ago, we were called licensed specialists in school psychology. We were not called school psychologists, which was, definitely different. And it definitely lended itself to um, us people being very confused about what we do and what we could do.
Your role.
But depending on where you are, like what state you're in, and even what district you're in, your job can look just a little bit different. And so my position does look different than that there of other places.
Mhm. Because your practicum was in Indiana, or did you also have to do a practicum or internship for your PhD program?
So I did for the school psychology
Mhm.
program, the specialist in school psychology, I had to do 4 practicums and I did also do a an internship. But
Okay.
my internship was out here, was
Okay.
in the same district that I'm in.
Okay. Okay. Um, so what made you choose this career path, or did you know getting into it that it would be um like this type of work, or the level of it? Was there anything that just sparked you along your journey, or did you always know this was the path that you wanted to take?
I did not always know that it was the path. When I first went to college, it was like I always know I wanted to work with children.
Mhm.
So initially, before college, I was saying pediatrician. Then I was like, yeah, no, not doing that. That whole medical scene. Mm-mm. But then I knew I loved psychology. I knew I wanted to work with children, all of those things. But then when I first went to undergrad, I was in education. But then after that first semester, it was like, I don't think this is it either. Then I found my love, which was psychology. Loved it, every drop of it. But we all know that in psychology, it's very difficult to just do undergrad in psychology and make decent money. You have to go on in psychology. And that is one thing that I would let every every freshman in psychology know, like you have to continue with psychology. Um, I know that now that, the state of America is focusing more on mental health. And so I think maybe it may be a little bit easier to find some positions with your undergrad in psychology, but to make the type of money or the type of impact you want, you're going to have to keep going. So anyway, I went into psychology. And we had times in which there would be other people to come in to talk about like different positions, but nobody ever talked about school psychology. It wasn't until I told my mom like I need a break from school once I graduated. Needed a break. And she was like, okay, that's cool. I said, I need to figure out like what I'm gonna do with my degree. And then she told me about how she was a school psychologist. I did not know that because at that time, my mom was in academia. So she was a professor, she was doing, administrative work at universities. So I had no idea at the time that she was a school psychologist. So she explained to me what she did and why she did it, all of those things. And I was like, oh, that sounds really good. Just so happened at the same time, there were some professors that she worked with that also had like some work that they were doing with what soon became my major professor, Dr. Ruskiba, at Indiana University. He was doing a lot of stuff with diversity, and he really wanted more people of color in school psychology. He was a white professor, but he was fighting. He's one of those that wants to fight. And so he really wanted more people of color in school psychology. So he was making a real push. And so I looked into it. And once I looked into it, I really enjoyed I felt like I was gonna really enjoy the work and being able to work with students and as well as put to use my psychology background. And so I just felt like I was marrying two things that I really enjoyed. And that's what I've been doing. So yeah, the job is tough and it becomes difficult because there's just a facet, a wide array of things that I do. But there's definitely fulfillment in it.
That is incredible. Like, I love this generational story of that being your mom's career, and unbeknownst to you, it kind of like,
Like
oh,
I had no idea. And she was
yeah,
actually a school psychologist when she was going back to school to get her doctorate degree. And then
wow,
that's when she got into academia. So yeah.
wow. And shout out to the advocates
Right.
that may not be they say they not our skin folk, but they are kinfolk. Um,
Right.
so I appreciate
Right.
the push, and the advocacy uh,
Yes.
for that.
Yes.
But that's a wonderful story. Thank you for sharing that with me.
No problem. No problem.
And that leans into our next question, which and you talked a bit about this. So you went from Grambling to Indiana to Hampton. So if you could just talk a little bit about the training that you need to be in the field and why you selected the schools that you did for that training.
So I believe you need a firm um, psychological mind, if that makes sense, to be a school psychologist. I saw the difference in what that looks like when I had she's kind of like a little sister to me, but she took a different route. Like her undergrad was not psychology. She took a different route. And so when she got into the school psychology program, there was just a lot of stuff that didn't fuse, I guess, with her that was automatic for me because of my background of psychology. It was a lot easier for me to do reports and understand how to um, quickly come to conclusions with like behaviors because of that psychology background that I got at Grambling State University.
Yeah.
And my professors that were very good. And I really attribute that foundation to them because had I not had that training, I do think that I would have struggled more with my graduate school, which was at Indiana University. So not only was I in school, of course, Indiana University is very different from Grambling State University. And although I didn't think that there would be a culture shock, there really was.
Mhm.
And so, um, thank God that there was a push, but it was only me and one other person of color in that program with me. And so, um, it just it was really hard for us because we had to and both of us went to HBCU, which was
Undergrad.
crazy, and both of us were sorors. So it was like really like it was great, but it was also telling like with some of the programs and stuff like that. So it just it was really helpful for me to have that background. Because I think if I had struggled in all of those areas, then I don't know if I would have continued or I always finish when I start, but I don't know that if I would have been in the field so long because it would just be a real major struggle for me.
Absolutely. And that's a part of the work that we're doing with HBCU Cares is trying to expose more students so the programs won't be to students of color and those numbers
Mhm.
can be increased because as you know, we definitely need more of us in the field.
Right,
Um,
right,
so
right.
now that you're
That's
in
right.
it and you got your degrees and you're in the space, And, you know, like, what's the rewarding parts of your job now that you're able to merge your passion of psychology and children? What brings you joy in this space?
What really I think is important is that I'm able to advocate for those Black and Brown students because there's a lot of emergencies that show up, and I'm able to step in and say, okay, no, this that's not what that is. You know, you would define it as this, and I would define it as this. These are the things that we kind of need to look at, and just kind of look at some different things before we are labeling all of our students. And I'm not saying that the eligibilities are not needed, because they are. We do need, interventions, but when we are quick to give these labels to certain students, then that's not beneficial for them. So I'm glad that I'm in a position to be able to look at those things, and even those students that are, in special education that don't no longer need that assistance, I can go ahead and say these are, we're good. He's learned. These are the interventions that we've put together, and these are the strides that he's been able to make. We no longer need to do all of these things. Um, and so that does bring me a lot of joy, especially with I say especially with the girls, but I think it's both. I
Yeah,
think it's both. But I had a lot of the girls when I was first getting into the profession. It was a lot of like really coaching the teachers and stuff with girls. So those being the advocate, or being one of the advocates, because I'm not saying that I'm the only one, but being one of the advocates is really being at the table and really talking about those behaviors and what they really mean and not what it looks like. I think that's rewarding,
absolutely.
because if we're not at the table, there's no one there to, explain and advocate.
And you're just able to bring in cultural nuances and
Hmm.
understand the students in a different way. Um,
Right.
and I've read so many studies about the treatment of students of color just because it's a lack of understanding of
Hmm.
the culture. And there was someone that I met at the ASCA conference recently, and he is in a district in Pennsylvania, and he's the only person of color in his district. And that just made me it makes me more appreciative of you and your role and the way that you're able to advocate because there will be cultural disconnects. And the more people that we have in the school system that look like us, the more that we can reduce the suspension rates or the behavioral adverse, right, or, just different spaces that children may be in that are unwarranted. Um, because they don't have someone there fighting for them and explaining cultural nuances that someone else may not get. So thank you.
Right. Right. It's Yeah, it's very important. And even with that person being the only one, like it takes some different type of strength that you have to pull. There was a school here in this district that I was placed in, and I was the only one on campus.
Mm,
And it's a lonely place. And it was just very interesting, like all of the resources you kind of have to pull from within yourself to just even be sitting in that situation.
yes. And
But you have to always remind yourself about the kids that are there.
mhm,
But yeah, and I had to coach one of my colleagues in the same position. He's a black man. We know there's not that many black men that are school counselors, school teachers, and definitely not school psychologists. And he's one, which I feel like he is like a diamond. Like, please stay, please. I'm gonna do
yeah,
whatever I can. I told him that from the day he got here.
We
He
have
always
one in
calls
our
me.
program.
He always calls me his mentor, but I wasn't trying to be his mentor or anything. But I'm just like, what do you need?
Yeah.
Who do I need to talk to? Because you need to feel supported, and I need you to understand and know we're gonna do what we can. But he was put in that position as well, and there were people on the campus that every day he came in that would ask him, was he? Why was he there? Yeah. So while it is good, it can be very difficult just in that realm of being the only one, and feeling away or feeling lonely or feeling, misunderstood or feeling like you're being threatened almost because, yeah,
And to your point, it goes to me back to your foundation that you had at Grambling. And that set the
yeah,
stage for community. It set the stage for the care, the love that you have to give to other people who may be in this space. And you can kind of embrace them as HBCUs do to us.
right,
So, like, I got you. We're going to get through this together,
right,
even if it's an environment where we're the only two. Like, we know we can get through it. So,
right, right.
yeah.
Yep. Absolutely.
Um,
Absolutely.
okay, so what advice, or if we want to use, I know what, okay, what advice would you give to someone aspiring to work in your field or another behavioral health field? I know one of the things you said was if you're doing psychology for undergrad, keep going so you can get your check. What else? What
Yes.
other advice would you give?
Um, I think if you're going into school psychology, um, one thing about my field, I feel like it's at this current time, I feel like it is kind of limiting. Um, the way the field is as it is right now, you only are able to practice within the school. And a lot of people want to do some other things, be able to be out in the community, you do some evaluations out in the community. And while our counterparts are able to do that, so when you're looking at speech language pathologists, which we also need people in speech language pathology, when you're looking at social work, all of those entities, they're able to do things outside in the community. They don't have to have an additional license or another license. And we all go through very intense training. School psychologists, you go through very intense training. You have at least a 3-year program, so it's almost like a clinical child psychology program, essentially. Um, it's limiting. What I would suggest, what I hate that I did not do, is also get the other licenses you would be able to get, like, that come up. So another license that was kind of introduced to me that I did not take part in and really didn't understand when I was going through the program was LPC, which is a licensed professional counselor.
Mhm.
Um, to be able to do some things like outside in the community, you need that license. So I would definitely look into that, just to make sure that you have um, kind of your ducks in a row to be able to do a variety of things. So you don't get bored in one place, if that makes sense. And
Yeah.
even if you're doing two things at once, because one thing that I also do is I teach at Texas Southern. So, like, being able to have a variety of things so you don't get bored. We're definitely in an age where people are not staying in one position in one job for 30 years. We're not doing that. So you want to make sure that you have um, a variety of things that you're able to do with the skills that you're being taught. And so I definitely would do that. Anytime any school psychologists are coming up under me, because I supervise a lot of students, I always tell them to get the LPC. Always. If they're a doctoral student, then I'm like, make sure you are putting yourself in a position to take the EPPP so that you can do some things on the outside of school.
That's really great information because our program is housed in the School of Education, but we have school counselors and we also have clinical mental health counselors. But the school counselors take all the courses that we would need to be eligible to receive our LPC. And I've kind of been on the fence about if I'm going to It is
This
your
is the Lord's way to tell you don't straddle.
Yes.
Get to that side and take
Okay.
it.
Okay.
Now that you have your courses, you know, when you have your courses, you go to the board, you see, you know, what else you need, and you take that test. Get that. And even if you don't, well, I say keep it up, but even if you don't, you have that in your back pocket.
Okay. Okay, awesome. Well, thank you so much. That's our series of questions. Is there anything that you want to add? Any special HBCU shout out before we hop off? Because I know I reserved 30 minutes of your time, and I want to be mindful of that.
Well, my love is always to be Grambling State University, where everybody is somebody. But I also have love for Hampton University as well. So I want to shout out all the HBCUs. Swag love first, but to all of the HBCUs. I love and adore all HBCUs. I always push people to go to HBCUs. It is an experience like no other. And so I always have love, all my money, all of the things go to HBCUs.
And we appreciate that. Thank you so much, Dr. Wright.
No problem.